What exactly is a bunion? Here's an X-ray showing that this is called the first metatarsal bone. This is second, third, fourth, and fifth. Normally, the first metatarsal bone should be going in the same direction as the second, third, and fourth. But because of hereditary reasons usually, nothing that people usually do during their lifetime causes bunions. People inherit them genetically, usually mother to daughter. And the way we measure the severity of a bunion is very simply, we draw a line down the second metatarsal, we draw a line down the first metatarsal, and as you can see, it forms an angle. And the worse the bunion gets, the worse the angle gets, etc. In addition to that, we find that the more the first metatarsal moves in this direction, the more the big toe is going to move over. And you see a perfect example here. You can see that this patient's first metatarsal is angulated. You can see the red irritation. So this patient has bursitis that they've developed as a result of having a bunion. You can see how their big toe is moving way over. And every year we see more patients with second toe hammer toes than any other toes, because very often the big toe will move over so far that people run into a situation that's like trying to park 5 cars in 4 parking spaces. There's no room for the second toe, and very often this will even cross over on the big toe. What you'll also see here on this particular patient's x-rays is, notice how the outside bone is also moved out the other way. This is, we'll be talking about in a minute or two, this is called a Taylor's bunion or a bunionette. And there is some evidence that people who inherit the gene for bunions also inherit the gene for Taylor's bunions. Okay, so how can a bunion be corrected with minimally invasive foot surgery? So here we have another example. Here's the first metatarsal. Again, you can see how it's angulated out. The big toe is going way, way in. No room for the second toe. So what is done in a case like this is the patient will have local anesthetic in this area. They will get an 1/8 of an inch incision on the top of their foot right in this area. And through that little incision, I would perform 2 separate procedures. The first one is to make a little cut, we call it an osteotomy, in the bone here, which allows me to shift the end of the bone back here where it belongs. And typically 85 or 90% of the bone will move back, and 10 or 15% will not. So of the 10 or 15% that won't move back in, to the same little incision, we can very simply smooth or remodel the side of the bone down. I should mention that there are some doctors that like to simply smooth this bump down and not realign the bone. Those almost always come back. It's not usually a question of if it's going to, it's when it's going to. And that procedure, because it has such a high recurrence rate, has very limited use. The other thing that we have to do in many cases of bunions is address the fact that the big toe is angulated over too far. And the way we do that is we make a second little incision right here, and we make a little wedge or pie-shaped cut, so that by closing the wedge, the big toe will move over. Here you see an example where I've done those procedures in addition to straightening the second hammer toe. So this patient had a little incision right here that you can barely see that little dark area. And through that incision, I made a cut in the bone. I repositioned the end of the bone inside their foot, remodeled the side of the bunion area. Second little incision, you can see the little mark right here. Brought that big toe over, and then once I brought that toe over, I was able to straighten out the second hammer toe as well. Many people that come to me for bunions don't actually have bunions. There's another common condition that is mistaken for bunions. Anyone have an idea what that might be? Okay, it's arthritis. And what you're looking at on this slide is the big toe joint is very prone to becoming arthritic. And when it does become arthritic, there is limited motion of the big toe joint. And the big toe joint has a very important function, of course, in gait, as you can imagine. So, many of my colleagues, again, like to insert things. They either like to put implants in the big toe joint, or they like to fuse the big toe joint, which I don't quite understand, because if the problem is limited motion, why would you want to stop it altogether? But we do have an excellent minimally invasive procedure, which we can remodel the bone spurs around the big toe joint and significantly improve the movement. Okay? Just to let you know that there's two severities that we classify arthritis in the big toe joint. If the motion in the big toe joint is limited but not completely stopped, we call that hallux limitus. Limitus for limited motion. If it's completely stopped, we call it hallux rigidus. It's a rigid joint, and the hallux, of course, is the medical name for the great toe. Okay, we talked about Taylor's bunions a second ago, also known as bunionettes. And here you can see another example. Notice how that the fifth metatarsal is angulating outward. It's not as straight as the fourth, third, or second metatarsal. Of course, this patient has a bunion as well. And again, the treatment for a Taylor's bunion or a bunionette is a little 1/8 of an inch incision right here, a little cut in the bone, and repositioning the bone where it used to be before it moved out. Most of the time with Taylor's bunions, the bone will move all the way back, so it's rarely necessary to smooth down the side. Okay? Very good. So that you see a good example. This girl, believe it or not, was only 18 years old and had a really bad Taylor's bunion. And she was a snow skier. There is nothing that makes Taylor's bunion hurt worse than putting it in a ski boot. Yeah. But you can see the little tiny incision here, and these usually heal very, very nicely.